off California, but we can't trigger off Idaho. I don't understand that. I'm just a simple guy from Eastern Oregon, but that doesn't make sense to me, so I've opposed this bill. Thank you.
Further discussion. Recognize Senator Bill Hansel.
Thank you, Mr. President. When this bill was before us, I pointed out that my District 29, on the entire eastern border of it and the entire northern border of it, it borders 2 states, Washington to the north, Idaho to the east. And that as the communities that are part of the counties, to have a different time zone, particularly to the north, which is the longest border, would cause a lot of difficulties for us, particularly in my area where we do a lot of commerce and interchange in the state of Washington, primarily Walla Walla, or even the Tri-Cities. So I said there were no triggers in the bill, therefore I was opposed to it. I want to commend the carrier of the bill. When it went to rules, they put the triggers in that I wish that I had hoped would be put in. In this case, both California and Washington are part of it. And so my vote, while it was no before, will be a yes today. Thank you, Mr. President.
Seeing no other in the queue body, the carrier has requested to speak a second time. Recognize Senator Kim Thatcher.
Thank you for that. I need to make a correction, at least in my memory. I think I said that the daylight savings time bill that we passed 5 years ago would have depended on the Department of Labor, and that is incorrect. It would have been the Department of Transportation, but that was when we were going to go as a group of Pacific Coast states and make that application, but California never came along, and they're looking like they are reversing their position on daylight saving time, and that's why this bill is brought before you. Because if the Department of Transportation did not approve, then it would have to rely on Congress, cough, cough, and that is also not the direction that things are moving. So as far as Idaho is concerned, yes, there was a request to be left out of the original bill, and then when I was asking if we could have that part of the state follow with Idaho, I don't know if there's a miscommunication or what, but my takeaway from the conversation with Legislative Council was that they couldn't. I think it was because the bill has to do, the underlying bill has to do with the part of the state that's in Pacific time, which is all of the state except for Malheur County. So anyway, those are just a couple of things. And this just aligns us with moves that other states make. It doesn't have us jump out ahead. And so I just want to make that correction. Thank you.
Further discussion to the measure. Seeing none, Senator Steinert, your closing.
Thank you, Mr. President. Just briefly, colleagues, I'm not going to add all the things that I added when we first discussed this bill. You remember them, I hope, about religious freedom, about the value of staying on the same time all year, about the circadian rhythm, being attuned to the natural rhythm of the sun. And while I appreciate the comments from my colleague from Senate District 13 about the value of natural light and exposure to daylight, that is particularly important in the morning. Our bodies benefit the most from light in the morning. And were we to stay on permanent daylight savings time, we would not have the value of that morning light at any time of year, and particularly in the winter when, given that our days are so short, we particularly need that morning light. Many people in the Northwest use artificial light, daylight spectrum light, early in the morning in the winter to correct the challenges from our brain chemistry. So one of the things that this bill will do is make sure that we don't have to have even more trouble with that going forward. There is no question that this bill has generated an enormous amount of controversy. You would not think that the time that we live in, the time of day it is, would generate so much mail on both sides of the issue. But my constituents and many of yours feel very strongly about this. They're about split 50-50. But in terms of health benefits, in terms of consistency, in terms of going with what our bodies are naturally programmed to do, in terms of allowing people whose religious calendars depend on being able to do certain things after the sun is up, permanent standard time is the best thing for all of us. I urge your aye vote. Thank you, Mr. President.
Question now arises upon third reading, final passage, Senate Bill 1548A. Those who are of the opinion the bill should be passed will answer aye as your name is called. Those opposed, no. Clerk, please call the roll.
Weber. Woods. Anderson. Bonham. Boquist. Campos. Dembro. Finley. Frederick. Gelser-Bluen. Gelser-Bluen. Gerard. Golden. Gorsuch. Hansel. Hayden. Jama. Knope. Lieber. Linthicum. Manning. Meek. Patterson. Brzezinski. Robinson. Brock Smith. Brock Smith. Solman. Steiner. Taylor. Thatcher. Gelser-Bluen. Brock Smith. Gelser-Bluen. President Wagner. Voting nay, Bonham, Bonham, Campos, Finley, Gelser-Bluen, Gerard, Hayden, Jama, Knope, Lieber, Manning, Patterson, Brock Smith, Taylor, Woods, 16 ayes.
Senate Bill 1548A, having received a constitutional majority, is declared passed. Clerk, please read the next bill.
Senate Bill 1503 relating to public health prescribing an effective date.
Recognize President Rob Wagner.
Thank you, Mr. President. Colleagues, I'm honored today to bring you Senate Bill 1503A. The bill creates a 17-member task force on community safety and firearm suicide prevention to study issues related to public health best practices for reducing deaths from community safety threats and suicide prevention. Suicide rates have been on the rise and continue to increase across the country since the COVID-19 pandemic. There have been promising signs that youth suicide rates may be decreasing, but Oregon's overall rate for all age groups is still tragically increasing. We lose 2 Oregonians every single day to suicide. It is just one of the leading causes of preventable death in our state. Oregon continues to have the 17th highest suicide rate in the nation, and this is just unacceptable. We have to do more to save lives. In Oregon, firearms are involved in the vast majority of suicides each year, with veterans, men, and our senior citizens at particular risk. The task force created by this bill is critical so we can continue our collective efforts to apply a public health lens to violence, overcome stigma around mental health, and support our neighbors who are most vulnerable. We've taken such action in recent session with Senator Hansel's Agri-Stress Helpline and Addie's Act to require student suicide plans in our schools. The measure directs the Department of Justice to provide staff support to the task force and appropriate $250,000 general fund to DOJ to contract with a third party to provide data-informed research and support requested by the task force. The task force sunsets on December 31st of 2026. I want to thank my colleagues, the senator from Springfield and Eugene and the senator from Eastern Oregon, who worked with me on this bill. There were several amendments added to the legislation based on those conversations, and I strongly believe that this bill is better for their feedback. Among these changes was expanding the task force to include a firearm safety representative and a law enforcement officer. In addition, the task force will have a broad range of stakeholders appointed by the governor, including a youth mental health professional, a tribal representative from a suicide prevention program, a public health researcher, a veterans mental health professional, and a person with lived family experience. Additionally, the task force will have 4 legislators, 1 from each legislative caucus. Senate Bill 1503A instructs the task force to dive into a number of vital questions around firearm suicide and associated community safety risks. Can we ask ourselves honestly, how do we better support youth and rural Oregonians expressing suicidal ideation? How does domestic violence intersect with community safety and suicide? What are the current community safety protocols around the state and across the country, including at our hospitals and behavioral health facilities? I believe we need to have the courage to confront these issues, and I urge your support for Senate Bill 1503A.
Discussion to the measure. Recognize Senator Bill Hansel.
Thank you, Mr. President. Colleagues, I am here with my colleague, Senate President Wagner, to support Senate Bill 1503A with the amendments. Senate Bill 1503 is a framework for a task force that will give recommendations on community safety and firearm suicide prevention, which will be staffed by the Department of Justice. Senate President Wagner has worked with my office on elements of this bill with the goal of putting together a task force to help with suicide prevention, something I care deeply about. As was mentioned in 2023, I was the chief sponsor of Senate Bill 955, more commonly known as the Agri-Stress Helpline in Oregon. This hotline is implemented by Oregon State University Extension Service, a trusted partner to ag families. The Agri-Stress was a program started in other states, and now Oregon with the addition to Colorado, Connecticut, Missouri, Montana, Pennsylvania, Texas, Virginia, Washington, and Wyoming. I come from a family of farmers. Agriculture is the #1 industry in my district. Farming, ranching, fisheries, forestry, etc. These folks are regrettably with some of the highest suicide rates nationally. These are the types of solutions I hope the task force will pursue. Look to solutions that have been implemented in other states. I'm really pleased with the amendments now in the bill with its emphasis on veterans and first responders. They are very similar to farmers, independent folks. I would ask that anyone watching this floor session reach out to our office or to the President's office if you have any suggestions or would like to serve on the task force. It is the goal to have different voices on the task force. We need to do what we can to help the mental health of Oregonians who have suicidal thoughts. It is my hope that this task force will be a step in that direction. I will be an aye vote on House Bill 1503A. Thank you.
Further discussion. Recognize Senator Deb Patterson.
Thank you, Mr. President. Colleagues, I rise in support of Senate Bill 1503B. In my 3 decades as clergy, I've sat with families in intensive care units for hours as they waited to learn whether their loved one would survive an attempt at suicide with a firearm. I've presided at funerals for older adults whose families were devastated by their deaths at their own hands with firearms. I've prayed and wept with a fellow clergywoman whose teenage son took his life with a firearm. Having served rural congregations in Illinois and in Oregon, I know that rural families are at particular risk for this loss. I urge your aye vote for this task force to prevent these needless deaths. Thank you.
Further discussion. Recognize Senator Przanski.
Thank you, Mr. President. Mr. President, I also stand in support of Senate Bill 1503B. From my upbringing and seeing individuals in my birth state that have taken their lives, unfortunately, with the use of a firearm, that is something that has been imprinted in my place. I own guns myself, but I also know that there are times where you need to have the ability for individuals to understand exactly what the risks are when they're not in their right mind. This is one of the areas that I think will be good by having the task force actually unbundle a lot of the areas that we have been more reluctant to talk about and actually address the issues that are before us. It's worth noting that in the Oregon Health Authority report that they had of firearm fatalities in Oregon reported 83% of suicides are from firearms. This is something that we need to address. We need to have an open discussion, and the task force will, in fact, allow us to do that. Thank you, Mr. President.
Further discussion. Recognize Senator Mark Meek.
Thank you, Mr. President. And colleagues, I stand up in support of Senate Bill 1503B this morning. And as I appreciate the work that this body is conducting this year, if we think about the legislation we passed in Senate Bill or House Bill 4002 on Friday,